Hi, I'm Dr. Bonnie Clipper, the Chief Clinical Officer at Wambi. Today, I am here with Dr. James Dickens, Senior Program Manager, Survey Branch for Centers for Medicare and Medicaid in Dallas.
Thank you.
James, thanks for being here with me today.
Thank you for having me.
And James, you certainly know more than most of us, our world continues to rapidly change. And as nurses and leaders, we often find ourselves in the center of things, and people look to us for guidance. What thoughts and insights can you share on how we can show up as our best selves every day? And most importantly, how can we help to make the world a better place right now?
Well, that's a great question, Bonnie, Dr. Clipper. And I start by saying, not only showing up, but showing out in a way that exemplifies or amplifies the, the experiences we have as nurse leaders, the experiences and education that we have as nurse leaders. And so the leadership piece, I think, stands out for me. Oftentimes we see on television that our colleagues, our physician colleagues, are on television and they answer the scientific questions. They answer the public health questions. They answer the public health emergency questions. And when we need a feel-good story, we have our nurses that come in for the feel-good stories. And it's unfortunate that media portrays nursing in that light. There are a lot of nurse leaders out in the public domain that can speak to epidemiology, that can speak to educating the public. I've worked with physician colleagues, and not to disparage my physician colleagues, but I've worked with physician colleagues for the last 30 plus years. And they rarely have I seen them educate a patient regarding next steps, what to expect in an environment like this. It's usually left up to our nurse colleagues. And so I think the leadership role is what we're missing in this space and this time for nursing. We're the most trusted profession years running. I think we lost it in 2001 during 9/11, and nursing has consistently been the most trusted profession in the United States. And so how do we omit, how is that message lost in our media, whether it's social media or any other spaces? And I know that you and your team at Wambi are doing a Herculean job to amplify not only nursing, but other professions as well. But the leadership piece, and Aristotle says, we are what we repeatedly do. Excellence then is not an act, it's a habit. And I think nursing, this is a space in which we live. And we have the opportunity to amplify this message, not only for nurses, but for our communities in which we live, and to be at the table, in the boardroom, making the decisions and giving a different perspective than, say, our physician colleagues and others that traditionally don't sit, that wouldn't give us an opportunity to sit around the table. The diversity and inclusion is a big piece. That's a message that's being amplified across the country at this time. And I would argue diversity and inclusion matters. And why does it matter? It matters because we don't want groupthink. We don't want everyone, that herd mentality. We want a difference of opinion so that we can review an issue or tackle a concern from every aspect. And so I think that's very important, the whole diversity and inclusion piece. I'm the first African-American board member for the American Association of Nurse Practitioners, first African-American male or female. But I think this is the first time that we've had an opportunity to inject a different flavor into the conversation. I'm still a nurse. I'm still an advanced practice nurse and working in that space. And so I bring a different perspective to the conversation when we have those conversations. And I hope that it's appreciated, that it's not groupthink. And this organization has shown that, it's an opportunity for us to grow as a leading nursing organization in the country. And so I think, like I said, the two things that I would take away would be leadership and diversity and inclusion in these spaces now as we move forward. But I think nursing is a trusted voice that has to be utilized and has to be utilized appropriately. The public health nursing sector, the funding for that has been cut tremendously over the last few years. by most municipalities, most local governments, and even the federal government in some instances. And so, what you'll see after this pandemic that we're all in and that we're worried about, whether we seen it coming or we didn't see it coming, that's we'll argue that, and that'll be in the after action report, and we'll work on that later. But what we do know is that our public health infrastructure in this country is problematic. And again, this is another place for nursing to step up and step out and show our leadership capabilities in this space. And we have some great leaders in this space that have been toiling in the brick pits for a long time in this space. And so hopefully they'll get the just due that they deserve in this space and be able to move us forward, not only as a profession in nursing, but as a nation. There's no excuse for what we're seeing transpire now. And I think nursing for the most part are poised with the leaders that can make a difference in this space.
You know, I love how you frame that, because I agree with you. Healthcare is a team sport, and every discipline is trained different and has different expertise and talents and gifts and skills. So it is going to take all of us being inclusive, working together to hear all of the voices, to come up with the best solutions, not only through the current pandemic, but to really retool a healthcare system that has proven to us it's not effective and it doesn't work for everyone.
Absolutely. And I would add, Dr. Clipper, there are no silos of excellence, and so we may think we're a silo of excellence, no matter what your discipline is. And this, again, not to disparage any discipline, but there are no silos of excellence. It's going to take us all to tackle these problems, many of which we haven't even scraped the surface of as of yet. And so, again, it'll take us all. And I think that, again, me being a nurse or male nurse, it'll take us all sitting around the table, an interprofessional, interdisciplinary team to solve the problems that we'll face in the future.
Absolutely. And James, where can people find you on social media?
Yeah, so I'm at JL Dickens NP on Twitter, JL Dickens NP on Instagram, and James L. Dickens on LinkedIn, James Lavelle Dickens on LinkedIn.
Well, I certainly appreciate you taking the time to be with us today. So thank you for that.
Thank you, Dr. Clipper, and hopefully, again, we will move forward as a unit and do great things for this country and for the world. So thank you for the opportunity.
Absolutely. And I am Dr. Bonnie Clipper. And remember, at Wambi, moments move us.